My name is Pankaj Balwani. I am CEO and founder of Xplore Health Technologies Private Limited. Medical IoT is a very huge market, currently at around close to under $22 billion. By next 5 years, this will reach up to $140 billion. If you see the current trends, what is happening in medical IoT, one of the big applications which has come to market is continuous glucose monitoring, CGMs. The same way, there is a big sector which is opening up with a much bigger and at least 10 times bigger application, which is to do with continuous patient monitoring. The latest advancements in medical IoT, I feel the biggest application is patient monitoring, as I mentioned earlier. If you look at the applications, one of the big applications where there is nothing available right now, say a patient who is discharged from hospital. Is there any way available right now where his doctor or his hospital can monitor him post-discharge when he is at home or he's away? Or maybe an international patient who's come to India for treatments. What is ways and means available for monitoring these patients? Another scenario I'll try to give, let's look at asymptomatic patient who may be having any kind of arrhythmia issue. Now, there are certain arrhythmias which are known to cause or increase the chances of person having a stroke in their lives. This is one of the arrhythmias called atrial fibrillation. The devices that can identify arrhythmias on a continuous basis can completely change and alter their treatment methods and the way they are managed. Devices, these are so advanced, they're able to monitor you 24/7. All the vitals are being recorded. Even while you sleep, their sleep monitoring is happening. Your respiratory rate is monitored. Overall vital signs are monitored. How is your resting heart rate? How is your HRV? How is your overall health? Everything can be monitored using these tracking devices. One of the biggest challenge that I see when we are going to various medical fraternities and meeting them and understanding their working and how they are treating their patients and how they're handling their patients. Also on the other side, we keep speaking to a lot of patients who are having known medical conditions. There are a lot of patients, in fact, there is bulk of patients basically who are not even aware if they have any kind of medical condition. These asymptomatic patients is the most dangerous scenario that medical industry is trying to solve, especially in the technology side. If a medical grade device or a wearable medical watch somebody is wearing, if any kind of medical condition he is going through, especially related to his vital signs, if there is an anomaly detected, if there is an arrhythmia detected, if there is a life-threatening event detected, one is able to know well in time and is able to take a right kind of advice and seek an intervention based on this medical grade data, and valuable lives can be saved or disabilities can be prevented. Take an example. Lot of times we come across in extended circles that somebody had a stroke suddenly. Nothing happens suddenly, especially not stroke. We have been in medical devices and wellness space since 2003. We have been into manufacturing and technology side since then. We were exploring a lot of technologies in the global market with regards to patient monitoring solutions. This has a very wide applications with various kind of medical conditions that can be monitored, various kind of patients that can be monitored using technologies. We came across a company called Cardiac Sense from Israel. We discussed with them, we collaborated with them. We as an Indian company invested in Cardiac Sense in Israel and brought this technology to India and have now launched this in India. One of the finest technologies which has been developed by scientists in Israel, which uses very, very unique set of sensors. These are optomechanical sensors which are able to very, very accurately see vital signs like heart rate, pulse rate, respiratory rate, take a very, very accurate ECG, also give relative stroke volumes. The kind of ECG reports they are the technology is able to generate also is able to detect many kind of arrhythmias and give its very, very accurate analytics. The idea basically of the technology is that when a patient is wearing a watch, whether he is a known cardiac condition or any kind of other chronic illnesses, we are able to track 24/7 their vital signs. Not only just tracking of vital signs, we are able to analyze all the information which we are able to generate every minute of the every second of the day. These are the kind of continuous monitoring solutions. I'm emphasizing on the word continuous monitoring, where beat by beat cardiac activity is recorded, breath by breath respiratory rate is recorded, various kind of vitals are recorded on a continuous basis, and we are able to analyze this information and give this medical grade information to the medical practitioners to give right kind of advice to the patients who are wearing these watches. Now, going one step further, we are also able to make this technology available to the hospitals for specifically integrating these technologies into their existing EMR systems, wherein all of the live information from the devices they will be able to see in the monitoring stations, as if a patient who's outside the hospital or in the medical center or outside the medical center, they are able to see them as if they were inside medical center. So if patient is having any kind of problem, they can be monitored. A quick live ECG can be taken by the patient sitting anywhere in the world, and the hospital or the medical caregivers can see the ECGs live or have a report available to them, quickly analyzed through the cloud, and a quick intervention and help can be given to the patients. We are planning to take this technology to all the medical practitioners who are handling various kind of chronic patients, be it cardiac diseases or COPD or any other diseases. We are taking this technology to hospitals and chain of clinics or the facilities, wherein say for example, a patient who's been recently discharged from a major surgery, or a patient who's been given an organ transplant and he's been discharged from the hospital. Is there any way these medical establishments have solutions to monitor these patients on a continual basis? It becomes even more difficult when these patients are mobile, when they are moving, they are living their lives on a daily basis. We have brought a technology called Cardiac Sense, where it's in form of a easy to wear medical watch. This medical watch is able to monitor these patients on a continual basis, and a patient is able to generate medical grade data and quickly share it with the caregivers and take and seek a quick medical advice whenever there is a need. And I think this is path breaking. Xplore is investing very heavily in R&D. We are coming with more and more applications on medical IoT technologies. We believe these applications will help caregivers in India to provide healthcare services with a lot of ease and with a lot of accuracy.